Officials across the country are bracing for a potential spike in COVID, flu, and RSV cases. Many are calling the simultaneous spread of the three viruses a tripledemic. On Thursday, the Center for Disease Control and Prevention began alerting those in the medical community about a substantial increase in severe strep A infections, also affecting children. And just before students left for their holiday break, schools from coast to coast began discussing the possibility of, get this, either reinstating indoor mask mandates or, once again, temporarily closing school campuses and daycares due to an alarming amount of absences. Now, according to the Washington Post, the Osage City School District in Kansas was forced to begin its holiday break 3 days earlier because 40% of its students were absent with illnesses. Joining me live to discuss is Dr. Nicole Swiner, a family medicine physician. Dr. Swiner, first of all, good morning, and how was your holiday?
Good morning, Nick. Good to see you. Thankfully, we had a pretty safe and small gathering here at my house, so we're doing well.
Was that a guideline we should all be following? Because you walked right into what I want to ask you. You said a small gathering, so you kept people close. What should people be doing now that the holidays are over? How long before we see the impacts of gathering and travel?
Well, usually it takes a good 5 days before you'll notice that you're having symptoms or that you may have been around or exposed to the virus, particularly with COVID. So it takes about 5 to 7 days to notice that you've even had any symptoms, if you have symptoms at all. So I think going back to the rules that we were following probably a year ago in terms of testing and masking and trying to social distance as much as you can inside. It's cold, outside, so that makes it a little bit more complicated, to stay further away from each other. But I think we need to go back to those rules that we were following about a year ago.
Dr. Swiner, you mentioned the M word, masking. Are friends and family giving you the side eye when you start suggesting that? Or how do you even introduce that conversation to friends?
It's difficult. I mean, I had a family that wanted to come and visit with us. I had my older father and his wife that came to visit, and we had already set our protocol. We have 2 school-age children, so we've tested and we knew what we were going to do. And someone wanted to come and visit kind of, late in the game. And I said, no, I think we've already set our routine. We know who's coming. We're going to test. Because we're all vaccinated, we knew that we didn't necessarily have to mask as long as our tests were negative, but it makes it a difficult conversation to tell your loved ones no, or this is what we're going to do. And so, it doesn't make it easy.
According to the CDC, RSV hospitalizations peaked after Thanksgiving. In fact, RSV hospitalizations were 5 times the rate of the same week last year in November. Is that a snippet of what's to come after the holiday season?
We don't know. We won't know until probably a week from now. But the way that trends are going, they called it the Thanksgiving effect. We probably have seen the highest numbers since the summertime because it's cold outside, particularly here in the Southeast. We've not been able to be outside as much as we'd like to be. So we're stuck inside together in close quarters and, not able to do the things that we would like to do safely as much as we did last year. So we'll see, but the trends aren't looking good.
You talked about the weather. This past weekend, we witnessed and even experienced that brutal Arctic blast coming from Canada. How could cold weather impact someone's health?
So, there's that myth that, being cold and wet, makes it easier for you to catch viruses and be sick. And we're not sure if that's true, but what we do know is that the colder it is outside, the closer we are together inside. So the fact that we're closer together, breathing on each other, definitely exposes us to more infection. And then when it's colder outside, people are a little less likely to go out and seek medical care. And so that delays the amount of time for people to get to their medical care, or may even prevent them from getting to their places of care. So that makes taking care of sick people a lot more challenging.
Dr. Swiner, how do we differentiate between RSV and maybe the flu or maybe COVID? What should we do? If I feel a little scratchy throat or sniffles, what would you recommend someone my age do as opposed to maybe a kid?
Yeah, so it makes it very challenging. So the tripledemic, along with strep A on top of it, makes it very challenging. But asking your medical provider, number one, and not relying on the internet or on things that you may know from your past makes it a little bit more challenging too. But asking your medical provider once you have any type of cold symptom that is a little bit more atypical than the usual cold. So strep throat is really, really, really bad throat pain. It can be fever, usually minus a cough, and then almost any of those other things can be associated with a cough. RSV is a little less likely a problem in adults. It's more an issue with babies and infants, but adults certainly can carry that germ too. So anything that is a little bit more, either lasts longer or feels worse, particularly with fatigue, with fever, go to your medical provider and let them check it out for you.
Dr. Swiner, I have less than a minute left, but I have one more question for you. The New Year celebration is right around the corner. We've gotten through Thanksgiving. We've gotten through Christmas. Any tips for people to stay safe in this last huge gathering for the holidays?
Get tested. Thankfully, you can get free home tests by, contacting your local health department or either the CDC or going online and getting a free home test. We have them stocked here. So anyone that's planning on visiting, we ask them where they've been, where they're coming from, are they having any symptoms before they walk into the house. We religiously sanitize, and I have the home test ready to swab any visitor that needs one when they step inside.
Safe to assume that your gathering will be less than 20 people, and anyone who does not have an invitation by now ain't coming?
No, don't do it.
Nicole, thank you so much. Dr. Swiner, I really appreciate you joining us this morning. Have a good day.
Absolutely. Happy New Year.
Happy New Year to you and your family, too.